Hello, good afternoon, good evening for anyone joining. I am going live today with the team at Laurel Fertility Care, Dr. Goud and Vanessa, who will be talking us through the surrogacy process. So we'll be talking all about the process, a roadmap of what to expect, why people consider surrogacy, what that looks like, who it can help, all of the above. And so have your questions ready. They are the most incredible team based in California, in San Francisco, with multiple clinics, a boutique approach. And we cannot wait to ask some questions tonight. So welcome to everyone, or today, for those who are in the States or coming in from Canada. Let's see, we're just waiting to be joined by Dr. Goud. And we're going to start talking about when you might look into surrogacy, when you should start your research, who it can help and what that timeline looks like, why go to Laurel Fertility Care for the surrogacy process and their experience in that, traditional versus gestational surrogacy, which I know sometimes people can get confused by, what the difference is, can your friend be a surrogate? All of these fantastic questions which we've had in advance. The team are writing an article around this because we've had requests for it. So please keep an eye out for that coming very soon. So let me just see if they're here. Welcome. Hi, everyone. Vanessa, you should be able to connect now. Hello, welcome.
Hi.
Nice to meet you. Nice to see you.
Nice to meet you too. I'm good. How are you?
Yeah, very well, thank you.
Good.
I'm just trying to get Dr. Goud in here. I'm inviting Laurel Fertility Care, but it's not letting me do that.
Okay,
Let's try again. Whilst I'm doing that, please do introduce yourself.
Yeah. Okay, so my name is Vanessa. I am the third-party coordinator here at Laurel Fertility. So I work with all patients that are intended parents, egg donors, known sperm donors, and gestational carriers. And just a little bit about myself. I have twins that are 15 that were conceived through IVF. So I have gone through that process from the egg retrieval to the transfer, and have insight to that, as well as I have been a gestational carrier 3 times.
Wow.
So I have insight to that side as well. So I think that it's a huge benefit for our patients that I can connect with both sides of it. Going through IVF myself and not knowing if we were going to be able to have children of our own really sparked a passion for growing families. And that's what really kickstarted me into wanting to become a gestational carrier. So I love all sides to it. And like I said, have a huge passion for growing families.
Amazing. Thank you for that introduction. I'm trying to add Laurel Fertility Care into the conversation. Okay, let's, oh, there we go. Great.
Oh, there we go.
Hello, lovely to meet you, Dr. Goud. How are you?
Yeah, very good. Very good.
Good. Thank you for joining us today. Please do introduce yourself.
Yeah, so this is Dr. Praveen Goud, and I just recently joined Laurel Fertility. I've been a reproductive endocrine infertility specialist in the field for several years. Just was working in Northern California for about the last 14 years.
Fantastic, fantastic. I've just been over in California and went to your fantastic event. So we did meet there, but it's so wonderful to be speaking with you live today, and to Vanessa, who's just introduced herself. So today we're going to be talking about surrogacy process, which I know you have a lot of experience in, and a roadmap of what to expect. So can I ask you both some questions, please?
Absolutely.
Okay. When should someone start looking into surrogacy, and for what reason?
Is that a question for me or for Vanessa?
Either of you, whoever, you could both give your take on it if you like, medically and also from an experience point of view, patient experience point of view.
Well, as far as medical reasons for surrogacy are concerned, those are the situations where, say, for example, somebody is born without a uterus. There's just no uterus. There could be some conditions like that. Similarly, there are conditions when there could be severe uterine factor, where the uterus is so bad, either that it has undergone changes due to multiple fibroids, which are, cannot be repaired and things like that. Or it could also be a situation where woman's health could potentially land in a jeopardy. Like, for example, there are certain heart conditions, certain, medical conditions which do not allow pregnancy to go securely. So those are medical reasons mainly that we see. Apart from that, we have also seen, people sometimes with, recurrent problems related to like multiple failures, when the uterine lining is too thin, when there is too much scarring inside the uterine uterus, and so on and so forth. So those are like the common reasons. Sometimes some women land up into a tragic loss of their uterus. For example, at the time of a C-section with this, profuse bleeding, and they have lost their uterus in a cesarean hysterectomy and so on, and that could be some other situations as well.
And Vanessa, what's been your experience of the patients that you've helped?
Yeah, so when to start looking into surrogacy, I will definitely say from the agency point of view, I do know that a lot of agencies are experiencing a wait list for matching with a gestational carrier. So really contacting those agencies, getting on their wait list, finding one that you connect with. There are some agencies that also require you to already have embryos made before they will match you with a gestational carrier. And different agencies can walk you through their reasonings for that point. But when I'm talking to my patients, really breaking it down that, if surrogacy is the route that you're going, let's work on creating the embryos, and then we can move to surrogacy as the next step, really breaking it down for them.
Do you find that people come in to see you expecting that they're going to be using a surrogate, or do you find that there's a process that happens with their own treatment before reaching that decision? I mean, if it's to men, for example, same-sex relationship, they'll know that going into it. But what's your take on it for people who might be using a surrogate for medical reasons?
I definitely think that the majority of our patients come to us already knowing that they're going to need a gestational carrier for the medical reasons that Dr. Goud spoke to earlier. When we have patients that transition from cycling themselves to needing to use a gestational carrier, sometimes we see them take a little bit of a break to be able to process that mentally and emotionally and make sure that they're ready for that. So I would definitely, the majority of patients come in already knowing that they're going to need a gestational carrier.
And when would you advise people to start their research if they're looking at surrogacy or gestational surrogacy as an option?
So coming back, you did mention about men in same-sex relationship. Of course, they are going to need an egg as well as the womb. So in that situation, they would need both an egg donor as well as a gestational carrier. As far as answering your question as to when would you propose, of course, the medical conditions that you mentioned. So when people come for consultations and they have such conditions, this comes up like an alternative. But most of the times I've seen in my practice that people have already researched significantly, and they kind of come that, this is what I'm going to do. I can actually recall an example of a recent patient a few months ago. And she was born at 2 years of age. She got severe kidney disease. So at 21, 22 years itself, she was wanting to have gestational carrier because her kidneys failed and she underwent lots and lots of problems, and using medications would have been very difficult. So in her situation, having a gestational carrier was really a boon, and her sister agreed for that, and subsequently things are going well with them.
Good. Okay. Interesting to know. You mentioned, Vanessa, the wait times. Is there a lack of surrogates currently?
No, Honestly, I won't say that I think that there's a lack of surrogates. I think, and this will go down a whole different road, but with the abortion bans in some of
Mm,
the different states in the US, you're finding that those states aren't seeing the surrogates that they were used to, and that intended parents are going to the states where they are comfortable knowing that their gestational care will be taken care of.
that makes complete sense. And in terms of a timeline, Laurel Fertility Care have the most incredible roadmap, which lays it out in such a simplistic way so that people can really understand it. Which is actually an article which we're writing together at the moment, which is fantastic. And that is going to be live very shortly. So watch this space. And in that, we have the timeline. Could you tell us a bit more about it, please?
Yeah, so I definitely think the number one thing when it comes to starting this process and any part of third party is really understanding what the different steps are and what the time frame looks like, because there's a lot of times where everyone feels that there's downtime and nothing is happening, and that starts to get the anxiety going, the emotions, the frustrations, and all of that. So really understanding what the expectations are from the clinic standpoint, from the agency standpoint, as well as the patient standpoint. So while you think that there's not a lot happening, there's still a lot happening behind the scenes, and everyone's kind of getting their things done. So really starting with the consultation, the testing and evaluation, that process, I always tell my patients on this part, it's really in your hands as far as the timing of getting that completed. That you have to be responsible for scheduling your first appointment, and the testing and evaluation based on the medical conditions, as Dr. Goud mentioned earlier. We can see that some patients are going to need some different evaluations from different special providers. So that's where that part comes into play.
Okay. Dr. Goud, do you have anything else to add on that in terms of the timeline?
So basically, when people come, they should understand that there are two components here. The two components, what nature does normally spontaneously, the ovulation and the fertilization of the egg and so on. And in this case, we can break it down into two processes. The first process involves, getting the eggs, fertilizing them. And now with the great advent of the freezing or vitrification that we have excellent results of freezing those embryos. So those people who are having a difficulty in finding the gestational carrier right away, for them there is a facility or a possibility for them to freeze those embryos, and then they can research further until they find the gestational carrier. So that way they are not losing on time, and the embryos are secured. And we all we have to do then is put the gestational carrier through, and there could be some wait period, wait time with respect to that. So that's what I thought I would like to add.
Fantastic, thank you. I'm sorry, the light's just gone out. I'm just going to switch to the light on. 1 second, please. There we go. Okay, hopefully you can see me better now. So I'd really like to understand a bit more. We just talked about the timeline, but when would a patient or prospective patient who's seeking surrogacy support come to Laurel Fertility Care? At what point in their journey? You mentioned that many people come to you knowing that they're going to need a gestational carrier. What do those conversations normally look like at that sort of first meeting, that first consult? And what's the hand-holding that you do to sort of holistically support someone going down this route to parenthood at Laurel Fertility Care?
Vanessa, you want to talk?
Sure. So when a patient comes to us already knowing that they're going to do gestational surrogacy, as I mentioned before, as a patient who's gone through IVF and somebody that's been a gestational carrier herself, I really want to make sure that our patients understand that they have personalized care here. While everyone might think anyone that chooses a gestational carrier is the same, it's not. So each patient is going to get that personalized care, however they're creating their embryos, and then moving forward from there.
Sorry, just on that point, I think it's amazing that you have that experience of having your own fertility journey and having been a surrogate, because people can ask you things that other people may not have had experience personally with. So it must be very reassuring for someone who is going down this route to be able to ask somebody things with first-hand experience from, you know, different experiences professionally and personally.
Yes. Yeah, that's one of the things I love, connecting with my intended parents, as well as even the surrogates that come through, you know, as I'm doing either calendar review, medication review with them, and really being able to share, hey, personally, this is what I did. This is how it worked for me. This is what didn't work for me. Because no one, there's individuals, once you learn that you have to use a gestational carrier to grow your family, not everyone thinks that that's how they're going to grow their family. And so they automatically feel that they're different, and that some questions are silly, but they're not. Like, ask the questions, because no questions are going to answer themselves. And to just be able to have those conversations. And I think once that they can understand that I've been there, I get it, I understand, that it really opens up that door, and they're able to feel a little bit more at ease and ask the questions that they probably wouldn't have asked before.
Dr. Goud, what are your thoughts on that?
Well, and in fact, what you initially asked was what kind of, how do we do, I mean, the process of holding the hand. So that compassion component is extremely, extremely important, because most of these, you know, they want to feel that they're not like missing something, or they're not deficient in something. And so there's sometimes some processes in the body where we just have to deal with them. So having them understand their condition, having them understand what alternatives would have been, and you know, discussing with them the benefits versus risks. And then of course there's a component that involves the whole practicalities involved, the cost of the whole process, and so on. So they need a significant amount of care, and that is something that we are here to offer them at Laurel Fertility.
Fantastic. For those people who might be new to learning more about surrogacy, please could you explain the difference between gestational carriers and traditional surrogacy?
So traditional surrogacy involves a process where the individuals, I mean, the same person is giving the eggs as well as carrying the pregnancy. So in several states, you know, as you know, traditional surrogacy is not the norm and may even be legally not allowed. However, a gestational carrier is a situation where the eggs may be coming from the patient, or from an egg donor, and the basically the embryo does not have any genetic connection with the gestational carrier. So basically, the gestational carrier is literally just carrying that embryo into her womb and nurturing it and developing it, and eventually after the birth, the baby is coming back to the intended parents. So traditional surrogacy would actually involve you know, a person carrying her own genetically connected pregnancy.
Anything that you want to add, Vanessa, to that?
No, I will just say that here at Laurel, we do not do traditional surrogacy. There's a lot more that's involved in it from the legal standpoint, that we do not participate in that. We work with gestational carriers.
And is it more commonplace now for people to use a gestational surrogate?
Absolutely. And I think, you know, when it comes to surrogacy, it's really all about the education. And that was another thing that I became really big on when I was a gestational carrier myself, that when you hear those terms and you're speaking to other individuals, automatically, I think everyone has the impression of the definition of traditional surrogate. So really making sure that everyone understands that the traditional piece is a genetic connection to the embryo, or not to the embryo, but to the pregnancy, where a gestational carrier is no biological connection.
And I think
go ahead, I'll talk afterwards.
I was just going to add to that. I mean, obviously, Laurel Fertility Care being based in California, California is such a great place for surrogacy, isn't it? And you're well versed to all of these scenarios, so people should feel in comfortable hands with the expertise that you have, the personal lived experience, the all of the above. Dr. Goud, what were you about to say?
Well, I was just saying that remember, we always, as healthcare providers or physicians or in general providers, we do take into account the not only the medical, ethical, and social aspects, because this is a very delicate subject. So we have to ensure also the health of the gestational carrier. We want to ensure that the pregnancy is not going to affect the gestational carrier, and the gestational carrier's health situations or lifestyle factors should not be affecting the fetus or the growing baby. So that's very important. We do involve a psychologist just to kind of review the whole process, how to deal with this whole thing, socially and in your family and so on and so forth. So there's multiple things involved, or multiple inputs or contributions are involved in this whole process.
Someone has just asked, does every state traditionally accept gestational carriers, even when the laws are different about surrogacy?
No, unfortunately, every state varies. You have some states that are very surrogate friendly. You have some where it's illegal, somewhere you can't have a legal agreement. Compensation varies from state to state and what that looks like legally. Really encourage all of our patients where you live, where the gestational carrier lives, to contact a family law attorney and to have those conversations, and make sure that you're getting your legal advice from a professional and not a friend or family member or even the clinic at that point.
That was actually my next question. Do some people come in asking whether a friend can be a surrogate?
They do. And so all surrogates, when you look at egg donation, you have anonymous or the non-identified and known donors. But when it comes to gestational carriers, all cases are known to the intended parents. So the gestational carrier and intended parents have met to some degree, whether it's a Zoom call, somehow some connection through an agency, but there's also lots of friends and family. You can watch a friend or family member struggle through infertility or knowing what their medical condition is at where they can't carry, and make that offer. We, like as Dr. Goud mentioned, all patients have to have a psychological consult, and for that there's a lot of people are hesitant going into it, and I always tell my patients that they're so glad that they did it when they walk away, that you're laying the expectations from the beginning, while you're going through the medical screening process, all the way through the journey, and not just ending with the pregnancy and delivery, but further down the road. What does that connection look like afterwards? What does the relationship, how do you talk to friends and family about, that you weren't pregnant, but now you have this child. So really being able to work through all those pieces. But to answer your question, yes, friends or family can be a gestational carrier for someone.
Yeah, or relatives, as you just mentioned.
Yes.
Do you think that sometimes that can be a bit close to home?
I do. I will definitely say that talking with patients that have gone that route, they don't always go the best. That there's lots of feelings and lots of emotions that happen through the process that I think sometimes can really damage relationships, but in some cases it can also really grow different relationships as well. My personal experience, I used an agency for all three of my journeys, and went into it with the expectation of whatever the intended parents want relationship wise afterwards is great. And I'm friends with all of them.
Oh, that's so lovely.
And at this point, it's more that we built this friendship that doesn't even have anything to do with the kids. We'll be talking or texting or hanging out, and it's kind of like, oh yeah, that's how we all got connected. That's why we're friends. So it's more of an afterthought, but just being able to handle how anything comes out, I think is easier not being related versus being related.
That relationship that you just mentioned is really nice. I guess, if intended parents, if parents are talking to their children about how they came into the world, being able to kind of put that puzzle together and bring that story together, I'm sure can help children understand.
Absolutely. Yes, for sure.
And Dr. Goud, from a medical point of view, how involved is a surrogate? So how does it work in terms of the intended parent or parents and the surrogate coming to the clinic when they're involved in different parts of the treatment? What happens there?
Well, most of the cases that I've seen, they're kind of very well connected. And I've seen that I've seen a very delicate bond between the intended parents, and I've also seen the respect for the gestational carrier, that she is doing what she is. Because the amount of I wouldn't say the word sacrifice as such, but yes, it's a lot to do as a gestational carrier. So I've seen them come together for appointments, being quite closely connected with respect to the findings as the gestational carrier is progressing. How does the uterus look? I mean, how does it look at the time of transfer, and so on and so forth. They also participate quite a bit during the process of embryo transfer and so on.
Yeah.
As far as their participation in subsequent time, I'm not so much experienced into that, and probably the technology is relatively early to tell what happens after 20 years and how does these children grow up and connect, and those would be the questions answered in the future.
Yeah, very good point. I think also we have so many readers who come to us looking at surrogacy as an option, and that might be international as well. So do you see lots of international patients who come to you because of your expertise?
Yes, sometimes in certain countries there are either restrictions or gestational carriers are not available, or they find a relative ease of going through the process here in terms of both advanced technology as well as the whole processing, the smoothness of processing. So we do see sometimes international patients coming through as well.
So for anyone who has just joined or watching this back, please head to our link in bio, because we have been working on a amazing deep dive surrogacy piece with the experts at Laurel Fertility Care. So really do turn to that, please, and do contact the team for help and a personalised plan and to have all of these questions answered. You were in expert hands, and it's lovely to have that professional side with also that experience-led side. So you've got that holistic offering. So for both of you, any final thoughts on the topic of surrogacy for us to finish with today?
Well, I would say that surrogacy is definitely an option that people need to know. I can actually recall certain members in my family who were, like, many years ago, when somebody tragically lost a uterus, had a hysterectomy, and they thought that that was the end. But so there is definitely an answer. As far as technology is concerned, maybe in the future sometime the embryos may grow to term all the way 9 months, but we are very, very, very far from that technology. So until that happens, we do need the surrogates. And on the other hand, for the people who are carrying pregnancy, I really, really applaud and really thank you for their great efforts, their dedication and their sacrifice of this time. So I really, I'm happy that there are some people like that in the society that are ready to help. So definitely, that's something that will prevail.
And Vanessa, any thoughts your side?
Kind of going off of what Dr. Goud said, just make sure that reach out, ask the questions, have the conversations. It's the most important part, in my opinion. A no is not a no until you hear a no, so don't automatically assume that it's no for you. Ask the questions, have the conversations.
Yeah, absolutely. Well, thank you both again so much.
Thank you for
Time.
having us.
Fascinating. Please head to the link in bio, read more, and do contact the team for expert guidance. Thank you everyone for joining.
Thank you
Bye,
very
guys.
much.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye. Bye.